everyone, my name is Liza Dalayat. I'm from Group 3 and I'm here with my group mates today to talk about the anatomy and physiology of the system affected, the pathophysiology and the nursing management of the disease osteoporosis. But first, let me have a brief discussion about osteoporosis. Osteoporosis, it is a progressive bone disease that weakens the bone, increase the risk of fractures. It is a silent disease because bone loss occurs without a symptoms. And osteoporosis is a major cause of fracture in postmenopausal women and older men. Fracture can occur in any bones but happen most often in the hips, the vertebrae, and the spine, and the wrist. And may papakita kaming picture dito sa video, and in this image that was viewed under the microscope, healthy bones or abnormal bones looks like a honeycombs, and the other is a bone with osteoporosis where the holes in the honeycombs are much larger than in a healthy bone.
The femur is the longest bone of the body, which has two ends of the joint called epiphysis, the shaft of the bone then called diaphysis. The external part of the diaphysis has cortical bone, which consists of many tiny cylinders or bars known as osteons. Each of it is made up of lamellae, which has a concrete layers of organic material called collagen and an organic material called hydroxyapatite, such as calcium phosphate. The center of the osteon is also called as Haversian canal, which contains the blood supply and for innervation. In the center of the bone is the medullary canal, a hollow space lined by spongy or honeycomb structure contains of bone marrow, the sites for blood cell production. Then the cross-linking road structure called trabeculae at the epiphysis is responsible to resist any stress in the bone. When the osteoblast sends microcracks, it produces a substance called RANKL, a receptor activator nuclear factor, KB ligand, and binds to RANK receptors on the surface of nearby monocytes, then uses them to fuse together in order to form a group of osteoclasts. Let it mature and activate to start reabsorption. The osteoclast then secretes lysosome, mostly collagenase, to break down the collagen protein on the organic matrix, the process in which called as the Hochschiff's lacuna. Then it starts producing hydrochloric acid or HCl to dissolve the hydroxyapatite into soluble calcium and phosphate, then release it to the bloodstream. Some of the osteocytes that are trapped within the matrix are eaten up or phagocytosed by the osteoclast. And in order to keep the resorption under control, osteoblast secretes osteoprotegerine, which binds to RANKL and prevents activating the RANK receptors. As a result, slows down the activation of osteoclast, and after osteoclast complete its work, it dies by means of apoptosis. Osteoblast now secretes osteorecin, a substance made out of collagen to fill in the lacuna created by the osteoclast. Calcium and phosphate deposits on the seam and forms hydroxyapatite. Thus, as osteoblasts keep producing new bony material, most of it will get trapped in the lacuna and turn into osteocytes, thereby contributes to the strength of the bone.
The parathyroid glands releases parathyroid hormones in response to a low blood calcium. The osteoblast then activates the RANKL or receptor activator of nuclear factor kappa beta ligand and triggers bone resorption to maintain its homeostasis. Therefore, if there is an increase in blood calcium, it signals the parathyroid to lessen the production of parathyroid hormone. Following the parathyroid that has a parafollicular cells which produces calcitonin, increase in calcitonin inhibits bone resorption if there is a decrease in blood calcium. Thus, the vitamin D stimulates intestinal absorption of calcium, thereby secretes the calcitonin and inhibits bone resorption.
Types of osteoporosis. Primary type 1 osteoporosis. Type 1 is generally referred to as postmenopausal osteoporosis, as this is more commonly seen among women who have gone through menopause, result in a drop in levels of estrogen. Primary type 1 osteoporosis occurs in women about 10 to 15 years after menopause, usually between the ages of 50 and 70.
Type 2 osteoporosis results in loss of outer bone structure and also the inner trabecular bone to wear down and become thick.
Type 2 osteoporosis have deficiency in dietary calcium and vitamin D decline due to age, with the hyperactivity of the parathyroid glands as risk factor that can hasten this condition.
Primary type 2 osteoporosis is also called low turnover osteoporosis because the rate of bones turnover is much lower in this type of osteoporosis. It is typically researched in hip fracture.
Bone loss due to normal age-related changes in bone remodeling as well as in extrinsic and intrinsic factors that exaggerate the process. Bone remodeling has two primary functions. 1. To repair microdamage within the skeleton to maintain skeletal strength and to supply calcium supply from the skeleton to maintain serum calcium. Excessive bone loss can be lost due to an increase in osteolastic activity or osteoblastic activity.
People that are at high risk of osteoporosis are people with a family history of the disease, men and women that are aged 50 and up who suffer from fractures, people who exercise too much but have poor diet, and lifestyle risk factors such as smoking, vitamin D deficiency, and drinking too much alcohol. The initial nursing diagnosis for a patient with osteoporosis may include acute pain related to fracture or muscle spasm and risk for injury related to osteoporosis such as wrist, hip, and spinal bone fracture. Additionally, ineffective coping related to uncertainty, inadequate resources, and change in socioeconomic status like job loss and financial situation may be one of the nursing diagnoses based on assessment data.
Deficient knowledge about the disease process and treatment regimen. Lack of understanding of osteoporosis can result in incorrect diagnosis and subsequent wrong treatment. Impaired physical mobility related to fractured ribs. The physical movement or action related to rib fractures, which can lead to bone fractures. Risk for constipation related to immobility or development of ill use. Constipation that causes difficulty moving and a lack of normal muscle contraction in the intestines should be one of the doctor's diagnoses.
And risk for injury related to osteoporosis such as wrist, hip, and spinal bone fracture. Additionally, ineffective coping related to uncertainty, inadequate resources, and change in socioeconomic status like job loss and financial situation may be one of the nursing diagnoses based on the assessment data.
Relieving pain. Encourage the patient to remain in bed for several minutes in the side-lying position. Make sure the bed is flat and non-sagging. Improving bowel movement. Encourage the patient to consume a high-fiber diet, drink more fluids, and take the prescribed stool softeners because constipation is one of the diagnoses in the situation at hand. Promoting understanding of osteoporosis and the treatment regimen. Make sure the osteoporosis patient is aware of the disease meaning, its causes, symptoms, and most importantly, how it should be treated.
Also encourage walking and good body mechanics. And the last, modification of a lifestyle.
By using proper body mechanics when walking, bending over, lifting objects, and carrying out daily activities, you can prevent muscular fatigue and injury.
Our prevention is lifestyle modification, exercise, nutrition, and sunlight exposure.
There are steps you may do at any age to prevent breaker bone. Eat crucial to consume food high in calcium and vitamin D. Regular weight bearing, exercise including lifting weight, walking, hiking, jogging, tennis, and dancing are also beneficial.
And how cold is